There's a very thin line between corruption and complicity. Our healthcare system is corrupt because we let corporations make profits on sickness. We let corporate lobbyists buy our lawmakers, and we refuse to make those same lawmakers accountable. The industry spends $1 million every day to buy lawmakers, governors, judges, and their minions. Because those who represent us allow themselves to be bought, tens of millions have no health care, and as many as 45,000 Americans die every year for lack of access. Louisiana Congressman Billy Tauzin led lawmakers to give $450 billion to private insurers in Bush's drug program. Then, surprise, surprise, Tauzin left Congress to become CEO at $2 million a year of the Pharma Drug Lobbying Group. Another lobbyist favorite is Senator Orrin Hatch, who received way over $1 million from the health industry between 2011 and 2016. Using the doublespeak of his corporate sponsors, he says covering everyone would cause a great increase in our federal budget. Of course it would. But Americans would no longer need to buy private insurance, so the actual cost would be half what it is now. And because he can't come up with a fact-based argument, the bought and paid-for Utah senator desperately argues that a single-payer system is socialized medicine. He fails to mention that we have many socialized institutions, universities, fire, police, schools, libraries, and dozens more, including the U.S. Congress, all socialized. The senator supports the corrupt private system when he knows the U.S. pays over $9,000 annually per citizen for health care, the highest of the largest 14 industrialized countries. England pays least at $3,400 and, according to the Commonwealth Fund, delivers the best care of the 14 countries. The U.S. pays most and delivers the worst. Perhaps the most deceitful word from Mr. Hatch is that universal health care won't work because it would be government-run. Hatch doesn't trust the government, but takes $174,000 salary every year plus benefits from the government. He has served as a senator for 38 years in the government and has been responsible for making the government work for almost 4 decades. The senator conveniently forgets that Medicare, with only 3% administrative costs, is government-run. Where is Mr. Hatch's outrage when General Motors and Wall Street banks receive trillions in government-run bailouts? Truth is, the single-payer option means our health system would have a public option like Medicare, with which private health plans would have to compete. The insistence of politicians like Hatch and Tauzin on partnering with the broken, corrupt private system guarantees failure. Their complicity and that of their fellow politicians is why we have the worst health system in the industrialized nations. It is why there is no cap on health care costs that have gone from 5% of GDP in 1960 to 17% in 2012. It is why 45,000 Americans die every year for lack of medical care and why millions of families go bankrupt. And Mr. Hatch and Mr. Tauzin, it is why we lose so many of our babies in the first year of life. It is time to match Germany, England, France, Canada, and all other countries who truly care about their people by providing health care for every person and who do it as a basic human right.